And good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for today, August the 12th. Based on the information or data coming out of the World Health Organization, the total number of confirmed cases of COVID-19 has passed the 20 million mark. And so at present, we have 20,162,474 confirmed cases of COVID-19. Yes, we have passed the 20 million mark. In terms of deaths, the death toll stands at 737,000, above 737,000. In the United States of America, in terms of the total confirmed cases, there are over 5 million cases in the United States alone. And in terms of the death toll in the US, it's almost 165,000. What's happening in the Caribbean region? Now, based on the latest situation report coming out of the Caribbean Public Health Agency dated August 10th, the total number of confirmed cases within the Caribbean region stands at over 129,000. But then the good news is we continue to fare quite well in the Caribbean. The total number of recoveries, almost 63,000, and the death toll continues to be relatively low, just about 2,000. However, the Caribbean Public Health Agency situation report continues to state that the risk of further cases occurring within the Caribbean region remains very high as we continue to accept our nationals from overseas, from hotspots. Okay, so what's happening locally? We are aware that we've only had 17 positive cases to date, and the good news is that they have all recovered. So at present, there are no active cases within the Federation. So far, we continue to test suspected cases and their contacts, and we continue to test nationals who would have returned from hotspots. And so to date, we've tested over 1,300 persons so far. At present, we have 53 persons in quarantine. These are nationals who would have returned. And we have, of these 53, 24 in quarantine here in St. Kitts and 29 on the island of Nevis. And so far, since we've been accepting nationals, since the closure of our borders, that's between April the 24th to present, the total number of nationals who have returned to the Federation so far stands at 163. Again, let me repeat, at present, there are no active cases of COVID-19, as far as we are aware, within the Federation of St. Kitts and Nevis. Having said that, if you were to look at the Center for Disease Control and Prevention on the St. Kitts and Nevis, you will realize that there is a travel advisory stating that we are at level 3. What does level 3 mean? It says and so this is the advice given to persons in the United States who are residing in the United States. This is the advice they are getting. They are being told to avoid non-essential travel to the Federation. If you were to peruse the site, it says COVID-19 risk in St. Kitts and Nevis is high. Wow. I want to reiterate that at present, there are no active cases of COVID-19 within the Federation. And so what we see here is really a misrepresentation of the situation as it exists on the ground. Next. Okay, just some further updates coming out of the New York Times today. There was an article that speaks to reopening of bars and restaurants in the U.S. and what they have found is that, or data coming out of the United States of America show that many of the new COVID-19 cases in the U.S. this summer are centered or can be traced to restaurants and bars. So quite a number of cases, new cases of COVID-19 in places like Louisiana, Maryland, Colorado, were traced to bars and restaurants. And so what the science is showing or seems to be showing is that indoor dining seems to be far more dangerous than outdoor eating. So the epidemiologists are arriving at consensus that indoor dining, especially in bars, seems likely or more likely to lead to outbreaks than outdoor settings. And so having said that, the bars and restaurants in our federation are open, and they are open to indoor dining. And so I just want to use this opportunity to remind the operators of bars and restaurants. I want to remind you of the non-pharmaceutical or non-pharmacological measures that are being used to control this pandemic so far, the wearing of the face mask. So we want the operators to insist that your patrons, your clients, enter at least wearing a mask and utilize same when they are not eating and drinking. Remember, hand hygiene is of paramount importance, and so there should be the availability of simple soap and water or hand sanitizers at the entrance and at appropriate locations within your facility. General hygiene is also very important, and so it's the need for you to clean the high-touch surfaces regularly, like the doorknobs, the knobs to the bathroom or the restroom, the counters, and even the tables where persons dine. So that's very important. We want you to use cleaning solutions that are appropriate for such settings. Remember physical distancing, and so the location of the tables around the chairs, and you should have appropriate number of chairs per table in keeping with the physical distancing and social distancing. I think it's our individual and collective responsibility to avoid big crowds. And so if you want to eat out and you go to a restaurant or a setting and there is a big crowd of people, it's your responsibility to, just turn away and choose another location where the crowd is not so large. So thank you.